Okay, Ignite. This is the latest device for 2024, so Optimus Max with all the newbies. The newbies on Optimus Max are the new IPL. More efficient, the hair that's on there, a new big forma. We kind of went over all that stuff. And now for the Ignite. The Ignite is brand new for 2024. And this is the device that Andrea uses a lot. And so it's one of my favorite lectures to give. Just know we just received FDA approval, maybe 2 months ago. I'm a little lost on time. So the point of the matter is, I don't think there's very few people in the country that actually have hand pieces. So I've been using this for about 3 or 4 months now. We've had it for a little longer, but because of the FDA, I had to get closer to approval. So when it comes to pictures, we have early pictures, but I'm excited to show you because they're pretty awesome. So on the Ignite, we've got a bunch of opportunities, and think of this, they call it surgical. None of this is surgery. You're like, oh, this is a surgical device. None of this is surgery. All of this is done in the office, under local, maybe local tumescent, with or without some PO meds. So none of this is surgical, it's all procedural. So they wrongly call this the surgical device. There's no surgery. This is all done in my office, not in the surgery center, in a side room, under a semi-sterile technique, under local. So all of these are procedural in nature, but they are on our scale, the other end of the scale. So we started in the shallow end, now we're jumping into the deep end. This is your most extreme version or forms of body contouring that we're gonna walk through today. And so we all know that in this space, it's skyrocketing. All of my patients, as a surgeon, all of my patients desire a bikini body without surgery. Now, that expectation isn't always realistic, but boy, we're sure getting closer and closer and closer as the years go on. No one wants incisions, no one wants downtime, but they all want the maximal result achievable. So that's what this is, body tight, face tight, AccuTight, and then the quantums. We're using radiofrequency. Sometimes we couple it with liposuction to create extreme levels of, or I should say varying levels of body contouring. They can be extreme, we'll show you pictures. So bipolar nature, so in my body tight, this is the most aggressive piece of equipment that I have from InMode, but it's still under local tumescent. In the office, semi-sterile procedure, I fill up the soft tissue envelope with tumescent solution, and I apply the treatment. It's bipolar nature, so the radiofrequency comes from the inside up to the external electrode, and everything in between gets treated with radiofrequency.